right, it's almost 1 o'clock, so welcome to the North Carolina Council on Developmental Disabilities Self-Advocate Discussion Series. I am Chris Hendricks, Policy Education Coordinator for the Council, and I'm joined by many members of the Council here in Carolina Beach. This discussion series is a place for North Carolina self-advocates to gather and engage with each other, to talk about things that affect our lives as people experiencing life with IDD and other disabilities. We want this time together to be used to get to know each other and to get to know the Council, where I and other individuals with IDD are leaders, colleagues, and valued for our input because we are who we are. People with disabilities should always be valued like that, and this discussion series will demonstrate why and how. Next, we're going to go over some guidelines for a better experience to maintain community and eliminate distraction really quickly. Virtual attendees are asked to use the direct chat feature for side conversations, please. Just go to the participant list and select the person you want to chat with. In-person attendees are asked to take side conversations into the hall. And lastly, please don't put lengthy resource information in the chat. To everyone, we are going to send a post-session email with all of the day's resources. If resource information is longer than an email address or website address and via chat, please send any resources to me, Chris Hendricks, or my colleague Melissa Schwartz in the chat privately. Now on to today's topic. Ladies and gentlemen, self-advocates and advocate champions, welcome to this very special edition of our self-advocate discussion series presented from Carolina Beach, North Carolina. Today's topic is transportation. We are getting an update around the Mobility for Everyone Everywhere micro-transit grant project from Kai Manast, and Philip Woodward will speak about paratransit and ADA regulations around transportation. To get things rolling, get that? Philip will share our jokes of the day. Philip is a systems change manager with the council. He is the staff liaison to the council's community living committee and our official dad joke teller. Take it away, Philip.
Good afternoon. This is Philip Woodward, System Change Manager. I'm a Caucasian male who's bald and I'm wearing a purple tie and shirt. Here is our joke of the day, our first one. How does a bus driver handle hard times? Any guesses? Anyone? The answer is one stop at a time, of course.
Ho-ho!
Okay, and then we have the next joke of the day. Why couldn't the bike stand up by itself? Any guesses? Anyone?
Tired is a guess.
The answer is it was too tired.
Well done, Pam.
And now I will talk a little bit about the ADA, Americans with Disabilities Act, and paratransit. Let's get into our topic conversation. Most days we have tasks outside of the home that we need to do to take care of ourselves, fulfill our purpose, and let's face it, enjoy our lives. The Encyclopedia Britannica's simple definition of transportation is the movement of persons or goods from place to place and the various means by which this movement is accomplished, i.e. planes, trains, and automobiles, etc. So where do people with IDD fit in? If we don't have the means to get where we need to go, it can seriously impact our physical and mental health. This discussion here today aims to get another step closer to a solution that fits everyone's personal situation. We may not get there today, but we can certainly head in the right direction. So then, what exactly does the Americans with Disabilities Act, or the ADA, say about transportation services? Here is a definition of paratransit services in plain language. Some public transportation services agencies provide fixed route transportation, such as a bus or a train. The Americans with Disabilities Act says these agencies must provide an equal service to people with disabilities who are unable to ride a fixed route service like a bus or a train. Can everybody hear me better now?
Yes.
This paratransit service will usually involve a vehicle picking up the person with a disability at home or close to their home and dropping them off at a specific destination. Now we will hear an update of an example of such a system from Kai Minus, and later I will offer what is new since last year. Many of you recognize our next guest. Kai has been both a panelist and a presenter for us in the past. Today he's here to share an update on the mobility for everyone, everywhere microtransit grant project. Kai will also share updates on transportation in general. For those of you who don't know him, oops, the slide I was going to read with his bio just disappeared. Let me pull that back out. Kai Minus is the director of the Public Transportation Group at the Institute for Transportation Research and Education at NC State University. I have to add a woo, go off pack. Kai worked closely with public transportation systems, the State Department of Transportation, also known as DOT, and other industry stakeholders providing training and advice for operational improvements, as well as conducting original research. He earned a doctorate in city and regional planning from UNC Chapel Hill, go Tar Heels, with research focused on performance measurement for public transportation. So please give a warm self-advocate welcome to our friend Kai Minus.
Thank you, everybody. And everyone can hear me? Is that correct? Okay. And the slides are, am I controlling the slides, Chris? No. Okay, great. So my name is Kai Monis. I'm with ITRI at NC State University, and I've been doing a lot of work with NC DOT on microtransit in North Carolina. I know throughout this presentation, I'll show you how microtransit has grown across the state. And for the next slide, I'll just tell you briefly about what, okay. Is that better? All right, so on the next slide, please, I'll talk briefly about what microtransit is. It is a technology-enabled shared ride public transportation service. Usually you'll have a mobile application that you use on your phone, and you'll request a trip and pay for the trip using your phone. there are wheelchair accessible vans on that provide microtransits. Some of the vehicles will be wheelchair accessible, some may not, but there should be enough wheelchair accessible vans to meet all the needs of people who require an accessible vehicle. And microtransit uses flexible routes with pickup and drop off points that are usually not predetermined. So normally the customer says, I am here, can you pick me up at this place and take me to this other place at right now? And it's great because it reduces the time between when you want to have a trip and when you can actually get the trip. Right now, with our demand response transportation that we have in the rural and urban areas across the state, you typically have a 24-hour wait time between when you request a trip and when you will receive the trip. And so microtransit, the goal for microtransit is to make it more convenient for people. So if they want to go to lunch, or if they want to visit a friend, or if they need to go to a doctor because they feel ill that morning, that they will have an opportunity to do that. So the plan, the NCDOT's goal with microtransit is to enable people who use public transportation to have travel times and mobility options that are similar to people who have their own vehicles and can drive their own vehicles. So that's what we're trying to accomplish with microtransit. Next slide, please. So we've been doing some research on microtransit riders because we do know that they look and act different than our typical demand response and fixed route ridership. And one of the concerns that we have is that if we replace demand response or fixed route, are we still able to carry the same people? So we want to be able to carry the same people that we're riding plus new people. And so we're looking very closely at the ridership trends in microtransit. And I just pulled out three graphics to show you the age, the distribution, the gender distribution, and the distribution of persons with disability who are riding microtransit in the 6 communities that have been in existence, have had microtransit since 2021. And what you'll see here on the age graph is that it actually looks pretty like a normal spread of riders. There are the dominant group of people is 21 to 40, but also 41 to 60. Those two together make up the predominant number of riders. There are 9% of the riders are 61 or above, and 15% are 21 or younger, or less than 21 years old. So that's not too surprising. Now the gender graph is definitely different. So public transportation tends to be utilized more by males than females in general, but we're seeing here that microtransit, females are using microtransit much more than males are. And I think it has a lot to do with the convenience and the safety features of microtransit. You do not have to walk. You don't have to stand outside on a corner in the dark. You can stay at your house until the vehicle arrives, and then you can leave your house to get onto the vehicle, and then the vehicle will take you directly where you want to go. So we think that's really good news to see that it's appealing to women more than men, or at least very appealing to women. And then as far as the disability population goes, 18% of the riders that we surveyed at these 6 sites say that they have some kind of mobility impairment, whereas 82% say that they have no impairment. It's very important that we make sure that persons with disabilities are able to get both legs of their trips served with microtransit, because in our demand response world, the transit system know who you are. They know that they dropped you off somewhere, and they have a reservation for you to be returned to your house. In the microtransit world, they don't know that. They don't know if you need a return trip because you don't make a reservation. You make an on-demand trip. So you might go somewhere, and we need to make sure that we have the capacity to bring you back from that location. And so some of our microtransit sites have realized that they've been running out of capacity, and it's very hard for them to serve persons with disabilities, especially people who require a wheelchair-equipped van. because it takes more time to load people, it looks like it is there's less availability for those vans. So just want to let you know that we're paying close attention to how people with disabilities are able to use microtransit. Next slide. Yes, thank you. And then this one's a little more complicated, but I wanted to just show, we asked people if microtransit were not available, how would they have gotten a ride? How would they have gotten where they wanted to go? And the blue columns show households that have 0 vehicles available, whereas the red columns show households that have 1 or more vehicles available. And what you'll see is for people who do not have a vehicle available, they're actually less likely to get a ride from somebody else than from households that do have vehicles available. And if there's no vehicle available, they're also less likely to use Uber or Lyft. But if there are no vehicles available in the house and microtransit's not an option, 19% of the people reported that they just would not have made that trip. And that's what we don't want to have happen. So this is a trip that meant something to somebody, and without this mobility option available, they just wouldn't have done it. And so we want to pay special attention to those trips that would not have been made. And I think microtransit, right there is just showing you that they've filled a gap. They were able to serve 19% more trips, and these trips wouldn't have happened without microtransit being available. And they're trips to the doctor, their trips to work, their trips to the grocery store, their trips to see friends, and they're very valuable trips to society. And then, walker, wheelchair, they would self-ambulate to get where they need to go. Some people would use a taxi, and some would use demand response transportation. That's what DRT stands for. And then some, if they had a vehicle, they would drive that vehicle. Next slide, please. Okay, so this is, I wanted to show you just the scale of how microtransit has been implemented across the state since 2020. So when we click the next, go ahead and click the next button. Oh, go back one, please. And then just click once. And there should be a time lapse. So you'll see here in 2020, we had 2 microtransit sites. In 2021, we added 2 more, including one in Wilmington, where we are. 2022, we added 3 microtransit sites in the state. And in 2023, we added 2 more. And then finally in 2024, we added 2 more for a total of 11 microtransit sites as of December 31st, 2024. On the next slide, you'll see what's happened since December 31st, 2024. As you'll see them start to grow, and this is all within an 8-month period. By August 1st, we expect to have 21 microtransit sites in North Carolina. Some of these are funded with local money. Some are replacing a federal and state funding that was used for fixed route and demand response, and they're using it for microtransit now. But a lot of these are Me&C project funded. So Me&C is Mobility for Everyone, Everywhere, North Carolina, and it is a federal US DOT grant that the North Carolina Department of Transportation applied for and won. That grant lasts 3 years from March 31st. It will expire 3 years from March 31st, and it's funding 11 microtransit sites across North Carolina. So we're really excited. We've been doing a lot of work to bring these sites online. That work involves working with the local community to understand where microtransit should go, what's the boundaries, what are the service times, how many vehicles are they going to need, how are they going to brand the service, to market the service. Oftentimes, the microtransit sites will involve bus wraps, which make the buses very colorful and very recognizable. And so with the marketing and the service planning, and we also have to come up with operational rules for microtransit, whether it's going to be curb-to-curb service, door-to-door, or stop-to-stop. Every community that we've worked with for microtransit, for Me&C especially, is completely different. They all have their own concerns, and they have their own needs. And the great thing about microtransit is we're able to tailor the implementation of microtransit to meet the needs of the community. So we're very excited that by August 1st, we should have 21 microtransit sites up in the state. And I think it's going to do a lot to increase mobility, especially for this community that we're speaking to right now. It should enable you to have um, transportation options that you didn't have, and to be a little more free to go places when you want to go there. And with that, I would like to open it up. Oh, sorry, there's one more slide. Great. So here's what we want to have happen. This is what we're trying to make sure that we're not just implementing microtransit, but we're doing it in an intelligent way. So number one, we need to make sure that the existing riders have microtransit as an option plus all the other options. We don't want to take away options. We want to add options to them. We want to make sure that new riders are attracted to the service. We want to reduce the time between when you want a trip and when you can actually take the trip. And we want to reduce the convenience gap between people who are able to drive themselves, have a car in the parking in the driveway, versus the people who cannot or are unwilling to drive themselves. And we also need to make sure that capacity is reserved for populations of special concern. We do not want to make a transit system, a microtransit system, where all the capacity is consumed by maybe a youthful, tech-savvy group that likes the convenience of microtransit, but the value of the trips is not that high. We need to make sure that people who really need the service will have options for using that service. And we think that microtransit is going to increase the community health benefits. We also think it's going to help with economic growth. And one thing that's really been excellent about microtransit, especially when they do those vehicle wraps and they have a great identity, is the community rallies around it. It creates a community identity, and it really strengthens that community. So that's what we're trying to accomplish. And I think I have some questions in the chat. Should I go through the questions right now? Okay. Let's see. Know where it starts right here. Do they have this service in Charlotte? So yes. So the question that I'm addressing is, do they have this service in Charlotte? So the Charlotte area transit system does have microtransit, and it started in February. It's not in Charlotte. It is in the Huntersville, Davidson area north of Charlotte. There is I think on the south end of Charlotte, there's also a private microtransit option that's free to everybody, but that's not funded through public money. Okay. Thank you. So Asheville is definitely missing from this list. You can see that from the map, and Asheville is an area that we need to work with to implement microtransit. We've had discussions with Buncombe County, where Asheville is situated, but at this time, there are no plans to implement microtransit in Asheville. And Morganton also, we have microtransit in Marion in McDowell County, but we do not have any plans at the moment for Morganton. However, as these new sites come online, I would not be surprised if Western Piedmont transit system that's based out of Hickory but serves Morganton. I would not be surprised if they start thinking about ways to implement microtransit there. So the question is about post-grant sustainability, which I'm assuming involves funding for when this money runs out. And that is the big question, is how do we keep microtransit going when the pilot funding runs out? Our best example so far is with the city of Wilson. They implemented microtransit in 2020. They have done a great job of identifying other funding sources, a lot of federal grants, and getting some state money through more interesting, more different ways than they used to. But one of the things that Wilson has also done is they've participated, that community participates in funding microtransit. So previously, perhaps they did not want to fund the fixed route transit. The city itself didn't want to put much money into fixed route transit, but they've seen that microtransit is so popular and so good for their community that the city is actually helping to pay for it now. And we've seen that with Gastonia as well. They implemented microtransit using federal funds, but when they needed more money, the city is actually putting up the money to help out. The next question is, how much does it cost? So the costs are determined by the local community. I will say that I personally am an advocate for fare-free public transportation. However, I do not advocate for fare-free microtransit. And the difference is with fixed route transit, there's usually a seat on the bus for another person. It really doesn't cost anything else because the bus is going to stop at that stop anyway. It's going to drop people off at the other stop anyway. Adding another person really has zero marginal cost. And if there's a lot of capacity on that bus, then my question is, why not make it free? Microtransit is different in that capacity we've seen gets consumed very quickly. It's very convenient service. It'll pick you up at your house and drop you off directly where you want to go. And maybe you only have to wait 15 or 20 minutes. It's so convenient that we need ways to manage demand, and pricing is probably our best way of managing demand. And so what we've seen is some microtransit sites have fares that go up to $6. Some of them have fares that are as low as $1. Somewhere in between is probably what we're going to see at all the new implementations. But the other thing that having a fare enables us to do is to offer reduced fares for persons with disabilities and the elderly. And we have to have, that's another mechanism we can use to prioritize those populations of special concern. So if we charge $6 for the traditional riders, but then we have a $2 fare for persons with disabilities or seniors, you know, that is that's helping to suppress demand for the non-essential trips while enabling more capacity for the populations of special concern. The next question is, how many of these areas are rural? And so the Me and See grant is specifically focused on rural. So 9 of those sites are rural. And you'll see on the map that I gave you, you'll see that there's a large clustering of microtransit along the triangle area and the Charlotte area. So those areas are not rural. They're in existence because there's a local transit tax, and they're able to use that local transit tax to fund microtransit. So the rural areas do not have that local transit tax, but we're probably looking at about 40% of the microtransit sites of the 21 are rural, and about 60% are urban. The next question is, can we see if this is something that can be done in Wayne County? So Wayne County is where Goldsboro is.
Taking them home, or are they taking them home? Oh, okay.
It definitely an option for Goldsboro. Goldsboro has a version of microtransit that they've had in place for a long time. I forget the name of it, but I think changing that service to microtransit would be fairly easy. So it's certainly, we can get in touch with Don Willis, the director in Goldsboro, and talk about that if it's something that the community would like. Yes.
I apologize, Kai. We're going to have to, we got to keep this train rolling. We've got a lot more questions. We're going to save those questions in chat so that we can keep going. I'm so glad you get to stay with us. And Philip, we'll go back to you.
This is Philip Woodward here. Thank you very much, Kai. So I'm waiting for the other slide deck. Okay, come back on. Great. So next, I want to tell you all what's new this year. Other than all the microtransit project that Kai mentioned, which is great to hear. Work Together NC has developed a transportation guide. I'm holding it up in front of me right now. It's called Transportation in North Carolina. A guide to transportation services, problems, and solutions. We hope the information in the guide may help you figure out a way to resolve any transportation barriers that you face wherever you live in our state. How to access the guide will be shared in the post-session resources email. So now I will pass things back to Chris for our poll questions and group discussion. Take it away, Chris.
Thanks so much, Philip. First, we want to learn a little bit more about who you are and what you think about this discussion series. In a moment, our virtual attendees will see a list of short questions in their screen, and in-person attendees have a handout on their table. It's a short poll. Each question is multiple choice. We ask that you please answer each of these questions because it helps the council make sure that we serve you as intended. It lets us know how to improve our activities. Melissa, it looks like you've already launched the poll. The first question, I'm going to read each one. It says, I am a self-advocate, parent or family member, or neither. The second question says, I live in a urban area / big city, or a rural area / small town. Number 3, I think the self-advocate discussion series is good, bad, or I don't know. Question number 4, I learn from the self-advocate discussion series always, sometimes, or never. And number 5, I use the Spanish language interpretation feature. In-person attendees, if you will just leave your polls on the table for staff to pick up at the end of the session. Did we get all our responses online? Okay. Thank you. We appreciate everyone's input. Your input helps us to keep improving our self-advocate discussion series. Now it's time for my favorite part. It's time for you, our self-advocate attendees, to share your thoughts on transportation services for persons with intellectual and developmental disabilities. If you'll direct your attention to the PowerPoint slide, you'll see some questions that you might consider answering. They are, question 1, what does accessible transportation look like to you? Question 2, what do you think is missing from accessible transportation? Question 3, where do you want to travel and why? That's a fun question. And question 4, please share a story of successful transportation accommodation services. And we're going to take 15 minutes to take anyone's question, either in the room or online. Olivia? Olivia, go ahead.
Yes. Hi. Like, one thing I think is missing from accessible transportation is its flexibility. So here in Goldsboro, Wayne County, the Goldsboro Wayne Transportation Authority only runs from 5:30 a.m. to 6:30 p.m. Monday through Friday, and from 9:30 a.m. to 6:30 p.m. on Saturdays. There is no Sunday service, and like I said, after 6:30, you cannot get any more bus service. But that's a problem, particularly I think for folks with disabilities, because everybody gets off work at like 4:30, 5 o'clock, and I feel like that's when most businesses are doing their most good business, and folks can't work because they have to leave. They have to leave work at call it 3:30 to get to make their way back on home. So having transportation that's more flexible would be a really good start. And I can speak to a little bit toward the Roanoke Public Transportation Authority, which serves like the Lake Gaston area and stuff like that. So a little bit further north of us. That's not really effectively run at all either. So having transportation that's a bit more flexible, that's not just, okay, you're only going to go to your doctor's appointments. What if you just because we're disabled doesn't mean we don't have rich lives there are so much we could do, but not having accessible transportation, I know for me at least, is not a good thing. I'm more isolated. I live in the rural part of Wayne County. I'm more isolated. I don't drive. It's hard to get driving lessons because they're too costly, and EIPD doesn't subsidize them. I've talked to my person at Trillium. They don't subsidize them. DSS doesn't subsidize them. And to me, all of them should, because it would improve independence, and I think it would make the business's bottom line better, because you're not having to. Folks are able to get to work easier and do things that they want to do, and it's not just being stuck. But I could go on, but I'm going to just stop there. Thank you.
Olivia, this is Chris. Thank you for that vulnerability. Kai, do you have any thoughts?
I do. Olivia here, absolutely correct. And it just comes down to funding. And right now, everyone is a little bit worried about funding. But ideal solution is that we will have not just public transportation in every community of North Carolina. We already have that. But what we don't have is convenient and accessible public transportation in every community. And those service hours are certainly an issue. Ending service at 5 or 6 o'clock in the afternoon certainly doesn't enable people to have productive jobs that oftentimes, like you said, those jobs might end at 6 or 7 or 8 or 9 o'clock, and they need to get back home from those jobs. So it's definitely something that we're aware of. Some communities are being a little bit more proactive about it, but I think you'll find that those are the communities that have that local transit tax funding. So they're able to expand hours and expand the geography of where they're serving. And it's a constant struggle between how we use the precious amount of funding that we have. And I know that for the latest infrastructure bill for transportation, North Carolina received about a 30% increase in public transportation funding. However, because of inflation, the cost of vehicles, and we have to pay operators, the drivers, more than we did before COVID. Because of all those factors, is actually our expenses are up 45%. So we got 30% more money, but our expenses are 45% more. So we've actually ended up losing money even with that increase. And it's something that we're keeping a close eye on, but our goal is to increase those hours across the state when we can.
Thank you, Kai. Laura, you have a question?
Can you hear me?
Sure can.
So, I can my husband fortunately can drive, but I know there for a while, when he wasn't able to drive and he was in a wheelchair, we were taking STS or special transportation. Well, with that, you have to reserve it like before 5 the previous day. And like one time they took us to church, but when they were really late picking us up. And when they came to pick him up, they didn't have a lift. They didn't know, like, oh, we didn't know he was on a wheelchair. I'm like, well, he was on a wheelchair when you dropped him off this morning. So, he didn't get healed at church. So he's still in the wheelchair. And so they just left us there. And we ended up fortunately getting somebody from church to bring us home. Um, and it just it's for people with disabilities, so it didn't make any sense that they wouldn't have a lift in their van. And I know one other time they had taken us to Festival in the Park, and they they couldn't pick us up. So fortunately, we had a friend who was able to take us home. But what if we didn't have a friend who could take us home? I mean, that's not cool. So, but I mean, I like the idea of this micro transit thing. And I know they said it was in Huntersville and Gastonia, but that's not really in Charlotte. So I don't know how that's going to work if you need a ride from, if you live in Charlotte, you wouldn't be able to really take advantage of it to take you anywhere, because yeah, I'm not sure how that would work. I mean, Huntersville is probably about 20 miles away from where we are. So, and it's not far if you can drive, but if you can't drive, then, it creates a problem. And, of course, like with some of these places where they have a Medicaid, transportation service, but you have to request that three days ahead of time, and that's free, but it cuts you off after 6 too. So, for people who come to our self-advocate group, that starts at 6. So then they wouldn't have a way to get there because that transportation service cuts off at 6. So, it's something that's better than nothing, but it's not, great. But I did hear that VR, I don't know how this, I went to this autism community event last week, and they were
Laura,
saying,
I'm sorry to
Oh.
interrupt. I apologize.
okay,
But this is actually a great segue into something Sean said and Ryan said in the chat. Sean Flag, if it's okay, I'm going to read what you shared in the chat. He said, to me, accessible transportation looks like taking a car or a train, except for it's free, short and sweet. And Ryan asked if I could recommend some specific talking points with council staff to then be shared with members that could be used in our future efforts to educate and inform NC legislators. And number one, I would absolutely work with my colleague Philip Woodward on that, as he is shared in the chat. But the one thing I can tell you as someone who goes to the legislature often is that, and it's something that we've heard before, and I don't know how helpful this is, but these stories that are being shared right now on this discussion series and the individual self-advocate stories that continue to be shared are the most powerful things that we can hold on to and showcase. The more we can be vulnerable, the more powerful and the more impactful they're going to be. But I really do understand your question, and I'm more than happy to get some specific talking points gathered. for you all. We have, I would say we maybe have time for one more question. If there's any more questions online or in the room. Do you have a question, Kay? Sure. Purple microphone.
This is Kay McMillan. She's a white woman with glasses.
I am very I love it that the a the window.
Kay finds it very ironic that paratransit has a 30-minute window.
Hey, you up right the person with this this will have a ten window.
Where somebody has a 30-minute window pickup time, where a person with a disability has a 10-minute window for pickup time.
The her stories from back to work and we like our parents
She's heard stories from friends at work and use paratransit.
yeah, that how we can cause them and say we can't pay you up and now they have to call it out of what
So paratransit called the morning they were supposed to go to work and told them they could not pick them up. And so now they've either got to find another way or call out of work.
we want the right the employment rate of people with disabilities so high.
And we wonder why the unemployment rate of people with disabilities is so high.
Uh, want my man so but
She's off one of her many soapboxes.
Kay, this is Chris. It's a really important soapbox. Uh, and you share it so eloquently, genuinely. Thank you for sharing that honesty and vulnerability. Thank you for all of your sharings of honesty and vulnerability today to our self-advocates in the room and not. I'm going to take a moment to go through some resources. We've got Work Together NC Transportation in North Carolina, a guide to transportation services, problems, and solutions. We've got the National Aging and Disability Transportation Center, Easter Seals Transportation Group, Disability Resource Center for the North Carolina Department of Transportation, the 2024 NC Transportation Summit videos, the North Carolina Council on Developmental Disabilities Community Living Mini Grants Initiative checklist developed by East Carolina University. These are all links. And there's two local resources, transportation directory list by county and Go Raleigh Access. Again, these resources are going to be shared out in a post resources email, including some resources shared in the chat. I want to take a little bit of an extra moment to apologize to any self-advocates that I had to jump in and cut off due to circumstances, special circumstances. We have to leave 5 extra minutes between our discussion series and our next presentation. But as always, we want to take the time, the council, to take the time to thank everyone who makes this presentation happen. Thanks so much to staff. Thank you so much to our ASL interpreters. Thank you so much to our Spanish language interpreters and our Spanish language recorder. And thank you so much to all of the people that make this work, make the magic work behind the scenes. This is so much, much more time. And especially, this was a really special session, and the magic would not have happened without our staff, especially Pam Hunter Dempsey and Melissa Schwartz. So thank you so much. And it looks like I may have gone a little too fast, which means we may end a little bit too early, but I think everyone here might be grateful for that. We're especially grateful, of course, to our self-advocates, because without you, this self-advocate discussion series would not exist. And this is where we want your voices to rise to the top. Thank you all so much. With that, we'll take a couple minutes break and
This is David. I'll mention for those who are council members and anyone who's in the self-advocate discussion series that would like to join us, we're resuming the rest of our council meeting. This was part of it, by the way, immediately following this. So, but give us a couple minutes for the link to actually work. So you may not have a waiting room, but if you try to click the link that I put in the chat, we'll have it up and running by 2 p.m.
thanks, David.